And good evening, everyone, and welcome to AIDS Call-In Live. My name is Kendall Moore, and I'm joined today by my colleague, Jolie Holliman. How are you?
Hi, I'm good. How are you?
Very good. And thank you for allowing us into your households this evening, and we definitely appreciate, we're going to appreciate any feedback that you may have for us. We're here on behalf of the AIDS Healthcare Foundation, which is a Los Angeles-based global nonprofit organization providing cutting-edge medicine and advocacy to more than 666,298 people in 38 countries. Jolie and I, we both represent the Chicago branch of AHF. AHF funds its mission to rid the world of AIDS through a network of pharmacies, thrift stores, healthcare contracts, and other strategic partnerships. We're generating new innovative ways of treatment, prevention, and advocacy, and we have been the hallmark which has been the hallmark of our success. And we're now currently leading a mass testing initiative to identify and treat 25 million people who are unaware that they are treated. Folks, first of all, let me say we just came off of World AIDS Day, just past Thursday, and it was a terrific weekend, and I want to just wish everyone who is impacted, affected, or has been infected by HIV and AIDS. AHF, we really pride ourselves on making sure that individuals who are affected and or infected with HIV and AIDS, that you do have a place to come, regardless of your ability to pay. Tonight's program, we're going to focus a little bit on what our specific services are here in the Chicagoland area. We have 2 clinics, and we will be giving those addresses out in just a moment. But the reason Jolie is here, outside of the fact that she's fantastic, she does a tremendous job with getting folks into our clinics. And so with that, let me introduce Jolie Holliman, who is our Linkage to Care Coordinator. Jolie, again, welcome to tonight's program.
Thank you. Thank you. It's nice to be here.
Got you. So Jolie, for the audience, give us a little bit about your background.
Sure. So my background actually is in mediation. So I come from alternative dispute resolution background, but I've worked with nonprofits, smaller nonprofits in Chicago, such as Task Force Community Services, Task Force Prevention Community Services on the West Side, Madison and Cicero, shout out to the West Side. They focus mostly on young LGBT community, largely minority communities that doesn't have that extra support that some of our North Side allies might have. So I'm from Task Force. I worked with them. I even recently was an interim ED for a point of time. And then I worked with a division of NIH called Adolescent Trials Network. And I worked on a grant that dealt with community mobilization. And it focused on how do communities, organizations, and government entities work together to make sure that we're preventing the spread of HIV among youth, 13 to 24. So it looked at what we could do as far as structural change objectives. So we call them SCOs. And we would plan out what type of structural change needs to take place so that we can see the end of AIDS. So especially when it comes to our youth, because youth are the only group, especially even in Chicago, that's still, you're seeing a rise in prevalence.
Gotcha.
So every other group you see that there's this decrease in prevalence. But when it comes to 20 to 29-year-olds, still an increase. It doesn't make any sense.
And when we say in youth, what's the specific gender that we're talking about? Or is it youth comprehensively?
Well, the truth of the matter is, for us here in the United States, when we're talking about youth, it's mostly African-American males.
Gotcha.
MSM, or men who sleep with men. So it could be bisexual, trisexual, men who have
sex
encounters
with men down low.
Are the ones, not are the ones, but are the groups that you'll see a lot of organizations are targeting to make sure that they're getting the information and staying healthy.
Gotcha.
So, but it's... I used to have an ED who used to say, I'm not HIV positive, but I'm HIV possible. Anyone is, has the possibility of getting HIV.
Sure.
It's about what you do to protect yourself. It's about the protective measures. So, but we're talking about, we'll get on that, I'm sure, at some point.
Absolutely.
Some of the protective measures, but talking about linkage to care. So I came from that group and working with community mobilization around that to working with AHF.
And here you are?
Yes. So
and we are happy to have you here.
I'm happy to be here. It's nice.
And so your transition from some of your former roles to being the linkage coordinator for the AIDS Healthcare Foundation, not to be redundant, but it's a tremendous job, particularly because Chicago is a huge metropolitan. I'm happy to report that we're not in the top 25 as far as new cases any longer, so that's a good thing. Nonetheless, there's still so many who are out of care, which makes your job that much more important. So the Linkage to Care coordinator, let the audience know exactly what it is that you do.
Sure. So linkage to care is something that is kind of interesting because you don't see it with a lot of other chronic illnesses, but you do with HIV. There's a person who specifically works with our patients to make sure that they have their needs met in order to stay in care. So that could be transportation, that could be other referrals, it could be housing referrals, it could be a number of things that people are struggling with that affects their ability to remain in care. So the linkage to care person is actually a person who works specifically to link a person who's found out that they have recently been diagnosed with HIV, or it could be a person who's fallen out of care, is to get that person linked back into care. And linkage is looked at by CDC standards as linking that person with at least 2 visits where they are seeing a healthcare provider.
Got you. And so when we say linkage to care, Jolie, let's pause for a moment. Walk me through an example. A person has tested and they've come back positive for HIV. What's the process?
So I'm going to touch on 2 things that we kind of talked about before, which was what linkage looks like for AHF and specifically, and then also what it looks like with us working with our community partners.
Understood.
So when it comes to someone being diagnosed, we do work with affiliates such as Southside Help Center, who does testing. They have a mobile testing unit. They actually have 2 now. Way to go. And so they might be doing testing, or it could be another of our community partners such as Brothers Health Collective, or as recent as Chicago House now works with us as well with sending referrals. So they identify a person who is positive with HIV, and then they will call me directly. So, and I'm going to give out my cell phone number a number of times because I just want everyone to have it out there.
Please do.
My number is 312-459-7612. Again, it's 312-459-7612. So they will call me directly when they identify a person who's living with HIV, and I will talk with that person and work with them to make a doctor's appointment right then and there.
Gotcha.
So the way that they've set it up for AHF, which is great, and I think that should be the case with any linkage. I mean, I know it's not easy, but I have access to the schedule for our clinics, so I can see who's on schedule for the clinics and what's available, and I can make that appointment right then. And our goal is always for someone who's newly diagnosed to get them in care within 72 hours.
Fantastic.
Yeah.
And the reason that I say that is because you hear the horror stories about individuals taking weeks and sometimes months getting into to see their doctor. So, you know, that time frame is absolutely fantastic.
Yeah. So we can do that within 72 hours, and then so that's the beginning part, right? It's making the appointment. But then it's the follow-up, making sure that they get to the appointment. If they need transportation help, you know, I can help them to get to the appointment and help them to get home from the appointment. It's also talking to them about their other needs. Are there mental health issues that need to be addressed? Are there other things about their living situation that need to be addressed? How do we make sure that they're set up for the best success and adherence? Because the other thing is talking about being ready to be on treatment. So I believe for most of AHF linkage persons, not just myself, but I'm trained in ARTIS, which is a CDC intervention, evidence-based intervention, which focuses on how do you prepare and walk through with someone what it means to be ready for antiretroviral treatment and what that looks like, and being honest about the difficulties about it, but then, you know, highlighting the strengths of what it means to be healthy.
Absolutely.
You know, so knowing is the first part. When you know, you manage, and then you live. That's it.
All right. Listen, folks, this is a call-in live show, and so please feel free to give us a call with any questions. You can reach us at 312-738-1060. Again, that number is 312-738-1060. Jolie, so when linked to you and that process occurs, the clinics, our clinics are located.
So I have that information too. So we have 2 clinics in Chicago now. We just opened up our Hyde Park clinic last year. So we are growing, which is great because there's a great need. Both clinics are on the south side. The first one is at 2600 South Michigan. It's lower level. The suite is a lower level, so you just go right downstairs. The number to that clinic I want to give you too is 312-881-3050. And then our second location in Hyde Park is 1515 East 52nd Place. And that's on the second floor, Suite 206. And the number there is the same, 312-881-3050.
And with each of those facilities on the Michigan, at the Michigan site, and not from what we want to convey to the audience, on Mondays, Wednesdays, and Thursdays, the HIV clinic runs from 11 o'clock until 3 p.m.
Right. Yeah.
Go ahead.
No, that's important to note. So, yeah, Mondays, Wednesdays, and Thursdays. Actually, Wednesday it runs from 11 o'clock to 8 p.m.
8 p.m., correct. There we go.
On Wednesday. So they're working diligently right now. Hello, everyone at the HCC. Thank you for the hard work. So Monday, Wednesday, and Thursdays are at 26 in Michigan, that location. Again, Monday and Thursday nights after 4 are our wellness clinic, which means the wellness clinic, please take note. You can walk into our wellness clinic for any type of concern. If you want to be tested for HIV, if you want to be tested for other STIs, the doctor is on hand, and you can come in and it's nominal what you have to do. You just kind of fill out something on HealthVana. We have a kind of spiffy new technology system where you just fill that out, and then you can be seen right then from 4 to 8. So.
And that is on?
That is on Monday and Thursday evenings from 4 to 8 p.m. From 4 to 8 p.m.
And so wellness, let's talk a little bit about our wellness clinics there.
Sure.
And so wellness, for folks who may not be aware, wellness deals with your comprehensive STIs. So we're talking gonorrhea, chlamydia, and syphilis. And I do want to mention to those who are out there that we also prescribe PrEP as well during the course of that clinic.
That was on my, about prevention.
So let's talk about prevention.
Sorry, I got to talk about PrEP. Last time I was here, I talked about PrEP with the nurses, the Black Nurses Union. But,
Sure.
But PrEP is, a lot of people don't know about it, but PrEP is a tool in our toolbox. It's not the end all to be all, but it is a definite tool that most people don't know about and need to know about. So PrEP is a 1-a-day drug. It's a component of what someone would take who would be living with HIV. It's Truvada is actually the name of the drug. So they take that component out of antiretroviral treatment, and you can take that once a day and protect yourself from getting HIV. That's it. That's all.
That's simple.
So that's simple. Once a day. Now, I say that, and it is that simple, but to be honest and forthcoming, it really should be a part of a comprehensive treatment. So you should be seeing your doctor regularly. You should be making sure that you're protected against other STIs. So it's one thing, though, one less thing to worry about if it fits for you. Because everyone is different. But that is a tool. It's like condoms are a tool, birth control is a tool. There are all these different things that can protect you in the ways that you need to be protected, and PrEP is one. And so we need to be talking about that more, especially in our communities, especially on the west side, the south side, where we're seeing a growing population of minorities who don't know about what tools are available to them. That's why I'm happy to see that we're here. I'm happy to see the work that we're doing, because we need to make sure that we're addressing some of the social determinants of health that keep a lot of our communities from getting the access to care that they need. So it's out there, it's available. It can be kind of expensive for some, but because there is this raising of awareness of PrEP and the accessibility to it, there are grants that CDPH has put out just in this last year that are working to expand awareness and therefore expand opportunities for people to get on PrEP. This is the best time to find out more. Ask your doctor about it or give us a call.
And again, our number at the clinic is 312-881-3050. The call-in number here, folks, if you have any questions, 312-738-1060. Again, that number is 312-738-1060. Listen, speaking of medications, I would be remiss if I did not mention the pharmacy services
Yes.
that we incorporate at AHF. And so we make it easy. We do assist with Medicaid, Medicare, ADAP, and most private insurance plans. It's also hassle-free filling of any and all prescriptions in-store by phone and by e-prescribing. We also have speedy confidential delivery and shipping at no cost. There's a convenient pickup availability at your nearest AHF pharmacy or AHF healthcare center. And again, the addresses to those are 2600 South on Michigan, lower level D, and in the middle of Hyde Park, right above and behind Mellow Yellow, which is 1515 East 52nd Place on the second floor, Suite 206. Continuing with the pharmacy, it's free HIV testing at selected sites, and then there's a personalized consultation and supportive services to address your individual needs. So folks, for those who are out there and you're looking at this program, you may not want to call in, please write this information down, make a note of it, and please feel free to give us a call once we are off of the air. Tonight our clinic is open until 8 o'clock. Tomorrow we are open beginning at 11 a.m. But Jolie is open 24 hours a day, and so am
I
I.
don't like the way you said that, but yes. But you knew what he meant, right?
Absolutely. Yes, yes.
But seriously, what he said is true. Call me. Call me if you have questions about anything that we've discussed and you didn't feel comfortable calling right now. You can call me at that cell phone number, and I'm going to give it to you again. It's 312-459-7612. 312-459-7612.
And so for all of the providers that are out there, and again, for just the laymen who are listening to tonight's program, irregardless of your ability to pay, we afford and we offer you our services 24 hours a day. And we strongly encourage you, even for those who are who may not be impacted and or affected by HIV and AIDS, you may know of someone. Let us be your first choice. Let us be your first start. It's full comprehensive services for the cascade of HIV and AIDS. And so, what Jolie does and what I do as the pharmacy sales specialist, we make sure that we connect patients and individuals to the resources that you may not be aware of. So not only does Jolie connect patients to our clinic, but there are additional ancillary resources that she also connects individuals to. And Jolie, I guess I'll ask you to talk a little bit about that.
Sure. So I think I mentioned before, too, as far as making sure that people have what they need in order to be in care. Because it's kind of hard to be concerned about your doctor's visit or the pills that you need to take when you don't know where you're going to live, or you don't know how you're going to get to the visit, or you don't know where your next meal is coming from. So a lot of what we want to do at AHF is meet those needs by working with our community. So there are other organizations that we work with. Our case management comes through AIDS Foundation of Chicago. We're working again with Chicago House and making referrals for Hep C case management too, so working with Haymarket. So we're really trying to make sure that we're utilizing what's already happening in the community and just adding on to the resources that we have as far as a clinic, and working with the resources that the community has as far as case management, as far as mental health, as far as housing, and even, I think the other day we were referring someone to some assistance for food, so all those different things. And when it comes to insurance, I did want to make mention about this because I think this is one of the great things about AHF, and even in our local AFC does the same thing, really wants to make sure that our communities know how to advocate for themselves. We've got to learn how to advocate for ourselves. We are the ones that we're waiting for. There's no one else coming. It is us. So we have to learn to have our own voice. So when it comes down to it, there's AHF does something called Speak Out. So there's speakout.org where you can go and agree to talking to your legislator about things that might impact you. And right now we have a lot of changes happening in the country. So when it comes to looking at what medication costs, there's price gouging already happening now, so thinking about what could happen in the future.
Oh, absolutely.
Making sure that we are speaking out and letting people know that it's not fair to price gouge and that we need to protect things like 340B pricing. 340B pricing is exactly what helps organizations to have the extra income in order to protect jobs like mine, where there is a person who can work with certain populations and work with people day to day to make sure that they remain in care.
Yeah, and you bring up an excellent point, and that point is, with the climate of today's political landscape, and more specifically here in the state of Illinois, with what we're dealing with a locked budget downstate with Governor Rauner, AHF, we do have the ability to usurp many of those processes because we are a not-for-profit and we are the largest aid servicing organization in the world. And because of our pharmacy services, we're able to assist folks who otherwise would not have the ability to pay. And the reason for it, ladies and gentlemen, is because 96 cents of every dollar goes back into programming at AHF. And so I humbly submit to you to consider us as one of your choices, if not your choice, to fill your prescriptions and your pharmacy needs. Again, 96 cents of every dollar goes back into services for the services that we provide to you in the community. And, not to badmouth other pharmacies, and I won't even mention them, but just think about when you do go to other pharmacies and all you do is give them your money, and sometimes there's a headache because your medication is not ready, it's incorrect, and they may not be culturally competent relative to the type of medication that you need because you are impacted by HIV and or AIDS. We do, and that's what we specialize in. So keep that in mind. And then, Julie, I want to go back to what you said, the political climate and where we are moving forward with the new president that has been elected, Ryan White. We don't know what's going to happen with that funding. But even before we go to the national level, here in the state of Illinois, it's going to be
budget crisis.
It's a budget crisis.
Right. We don't have
and so, folks, fear not. And and it's not spooky television, but AHF, we certainly will not, and we are not impacted by the budget stalemate that's happening downstate, which is why we're here to make sure that you guys are aware that we are an additional resource in your toolbox. Jolie, as we get ready to get off of the air, I certainly want us to make sure folks visit our website. You can get more information on the AIDS Healthcare Foundation at aidshealth.org. That's AIDS Health, HEALTH .org. You can visit our website. Again, our local number here is 312-881-3050, 881-3050, Julie, and your phone number. I got you down, but go ahead.
It's 312-459-7612. I had to look at your sheet. 312-459-7612. And I just want to say thank you for having me on.
Not at all.
I really appreciate it. And I will say a lot of my clients love getting their scripts delivered. They really are appreciative for the opportunity to get their scripts right from AHF, have it delivered to their home, or just pick it up when they're coming for their next visit. So thank you for that.
And you know what? That's a very good point that you did bring up. And I think I briefly mentioned it, but I want to expound upon that. It's a very simple process. Folks do not have the ability to pick up their medications. We absolutely can have your medications delivered in the comfort and confidentiality of your home.
Yes.
So we do that. Jolie, give me your closing thoughts on tonight's program.
Closing thoughts are, let's do this. Let's work together. It really does take a community working together and looking out for one another. So my closing thoughts are, if you know someone or you are someone who's being impacted, don't think twice about it. Give me a call, 312-459-7612.
Thank you, folks, for allowing us into your living rooms this evening. Again, give us a call at AHF, and until next time, we'll see you again.